Have you ever noticed your legs feeling heavy, cold, or tired, even when you haven't been standing for very long? Maybe you wake up in the morning and your legs feel stiff, or after sitting for a while, you stand up and it takes a few seconds before your legs feel normal again. Some people notice swelling around their ankles by the end of the day. Others feel tingling, numbness, or even cramps in their calves at night. Most people ignore these signs. They assume it's just part of getting older. But here's something many people don't realize. These symptoms are often early warning signs of poor leg circulation. And when circulation in the legs starts to slow down, it can affect much more than just comfort. Your legs rely on strong blood flow to carry oxygen and nutrients to the muscles and nerves. When circulation becomes weak, those tissues don't receive the support they need. That's when problems can begin. Your legs may feel tired more quickly. Your feet may feel colder than usual. Your muscles may cramp during the night. And if poor circulation continues for years, it can increase the risk of more serious issues like nerve damage, chronic swelling, or even blood clots. The surprising thing is that many people don't realize their circulation is slowing down until the symptoms become more obvious. But there's a simple way to check. After more than 40 years working with patients dealing with heart and circulation problems, many specialists recommend a quick 30-second circulation test you can do right at home. It doesn't require any equipment, it takes less than half a minute, and it can give you a useful clue about how well blood is moving through your legs. In this video, I'm going to show you exactly how to do that simple test. Then I'll share 3 gentle exercises that can help improve blood flow in the legs and support healthier circulation over time. These movements are simple, safe, and can be done by most people at home. Sometimes, small daily habits can make a bigger difference than people expect. So, before we get into the exercises, let's start with the quick 30-second test that can tell you a lot about the circulation in your legs. Before we talk about exercises that can improve circulation, let's start with something simple that many doctors recommend as a first step: a quick 30-second leg circulation test. This test isn't meant to diagnose a medical condition, but it can give you a helpful clue about how well blood is moving through your legs. And the best part is that you can do it right now, right at home. First, sit down comfortably on a chair or on the edge of your bed. Make sure your feet are flat on the floor and your legs are relaxed. Now, extend one leg straight out in front of you so that your heel is resting on the floor and your toes are pointing upward. Hold your leg in that position for about 10 seconds. While your leg is raised slightly, take a look at the color of your foot. In healthy circulation, the skin tone of your foot should remain fairly normal, pinkish or slightly pale, depending on your natural skin tone. Now here comes the second step. After those 10 seconds, slowly lower your leg back down and place your foot flat on the floor again. Watch what happens over the next 10 to 20 seconds. Normally, blood should flow quickly back into the foot. The color should return smoothly and evenly. But if the circulation in the leg is weaker than it should be, something different may happen. Some people notice that their foot becomes very pale when the leg is raised. Then, when the foot is lowered again, it may take several seconds longer for the normal color to return. In some cases, the foot may even appear slightly reddish or blotchy before returning to its normal color. These changes can sometimes suggest that blood flow in the legs is slower than it should be. Now again, this test is not a medical diagnosis. There can be many reasons for changes in skin color, and if you ever notice persistent symptoms like swelling, numbness, or pain in your legs, you should always discuss them with your doctor. But this simple test can sometimes give people an early hint that circulation in their legs may need more attention. So why does circulation in the legs become weaker in the first place? There are a few common reasons. One of the biggest factors is long periods of sitting. When you sit for extended periods, the muscles in your legs remain inactive. Those muscles normally help push blood back up toward the heart. Without that muscle movement, blood can begin to pool in the lower legs. Over time, this can lead to swelling, heaviness, or fatigue in the legs. Another factor is reduced physical activity. As people get older, many become less active than they were earlier in life. Muscles become weaker, and the circulatory system doesn't get the same level of stimulation it once did. This can slow down blood flow, particularly in the lower parts of the body. There are also natural changes in the blood vessels themselves. As we age, arteries and veins can gradually lose some of their flexibility. Blood vessels may become narrower, and circulation may not move as smoothly as it once did. All of these factors can contribute to poor circulation in the legs. And when circulation slows down, the body may start sending small warning signals. Your feet may feel colder than usual. Your legs may feel tired even after light activity. You might experience tingling, numbness, or muscle cramps at night. Many people ignore these signs because they seem minor at first. But the earlier circulation problems are addressed, the easier it is to improve blood flow and prevent more serious issues later. That's where gentle movement becomes extremely important. Your leg muscles act almost like a second pump for your circulatory system. Every time you walk, stretch, or move your legs, those muscles help push blood upward toward the heart. This keeps circulation active and prevents blood from pooling in the lower limbs. In the next section, I'll show you the first simple exercise that can help stimulate circulation in the legs. It takes less than a minute to do and can be performed almost anywhere, sitting in a chair, watching television, or even while working at a desk. And for many people, this small movement is enough to start improving blood flow right away. Now that you've seen the quick 30-second circulation test, let's talk about the first simple movement that can help improve blood flow in your legs. This exercise may look very small and simple, but it activates one of the most important circulation systems in the lower body, the calf muscle pump. Doctors sometimes call the calf muscles the second heart of the body. That's because every time your calf muscles contract, they help push blood upward from your legs back toward your heart. When you walk, this pump works naturally. But when you sit for long periods, watching television, working at a desk, driving, or resting, the calf muscles remain inactive. Without that muscle movement, blood can begin to slow down and pool in the lower legs. Over time, this can lead to several common symptoms. Your legs may feel heavy. Your ankles may swell slightly by the end of the day. Your feet may feel colder than usual. And at night, some people experience cramping in their calves or feet. The good news is that activating the calf muscles doesn't require intense exercise. Sometimes a simple movement is enough to stimulate circulation. Let me show you the first one. It's called the seated heel raise. You can do this exercise almost anywhere. Sit comfortably in a chair with your feet flat on the floor and your back straight. Now slowly lift your heels off the floor while keeping the balls of your feet on the ground. Your toes stay down and your heels rise upward. You should feel the muscles in your calves tightening slightly. Hold that position for about 2 seconds. Then slowly lower your heels back down to the floor. That's 1 repetition. Now repeat the movement again. Lift your heels slowly, hold for 2 seconds, then lower them back down. Try doing this movement 15 to 20 times in a row. As you perform the exercise, imagine your calf muscles gently squeezing the veins inside your legs. This squeezing motion helps push blood upward toward the heart. It's a very natural process that your body uses every time you walk. The difference is that this exercise allows you to activate that pump even when you're sitting. Many circulation specialists recommend doing this movement 2 or 3 times per day. For example, you could do it while watching television, reading, or sitting at your desk. The entire set takes less than a minute. But those small contractions in the calf muscles can significantly improve blood flow through the lower legs. Some people even notice that their feet begin to feel warmer shortly after doing the exercise. That's often a sign that circulation is improving. Another benefit of this movement is that it helps prevent blood from pooling in the ankles. When blood sits in the lower legs for long periods, fluid can sometimes leak into surrounding tissues. This is what causes swelling around the ankles or lower calves. By activating the calf muscles regularly, you help keep blood moving and reduce that pressure buildup. This is one reason doctors often encourage people who travel on long flights to move their feet and ankles periodically. The same principle applies during everyday life. The more often you activate those calf muscles, the easier it becomes for blood to circulate properly. Now here's something important to remember. This exercise should feel gentle and comfortable. You don't need to move quickly or force the motion. Slow, controlled movements work best. And if you ever feel pain in your calves while performing the exercise, stop and rest. For most people, though, this movement is extremely safe and easy to perform. Many patients who begin doing this simple exercise regularly notice that their legs feel lighter and less tired during the day. But this is only the first step. In the next section, I'm going to show you a second exercise that helps stimulate circulation in a slightly different way, by activating the muscles around the ankles and feet. And this movement is especially helpful for people who spend long periods sitting or standing during the day. Now let's move to the second exercise that can help improve circulation in your legs. While the first exercise focused on the calf muscles, this one focuses on something just as important: the ankle and foot muscles. Most people don't realize how much the ankles and feet contribute to healthy circulation. Your feet contain dozens of small muscles and blood vessels. When these muscles move regularly, they help keep blood flowing smoothly through the lower legs. But when the ankles stay still for long periods, blood flow can slow down. This often happens when people sit for long stretches during the day. Think about activities like watching television, working at a desk, driving long distances, or even sitting during long flights. In those situations, the ankles and feet may remain almost completely motionless. When that happens, circulation in the lower legs can become sluggish. Over time, this can cause several uncomfortable symptoms. Some people notice their feet becoming colder than usual. Others feel tingling or numbness in their toes. Some experience swelling around the ankles or a heavy feeling in their legs at the end of the day. The good news is that a simple ankle movement can help stimulate circulation and reduce these problems. This movement is called the ankle pump exercise, and it's incredibly simple to do. You can perform it while sitting in a chair, lying on your back, or even while relaxing in bed. Here's how it works. Start by sitting comfortably with your legs extended slightly in front of you. Your heels should be resting on the floor. Now slowly point your toes forward, as if you are pressing a gas pedal in a car. Hold that position for about 2 seconds. Then slowly pull your toes back toward your body, pointing them upward. Again, hold that position for 2 seconds. Now repeat the movement. Point the toes forward, then pull them back toward your body. This forward and back motion activates the muscles in your calves, ankles, and feet. Those muscle contractions gently squeeze the veins in your legs, helping blood move upward toward the heart. Think of it like a pump that pushes blood out of the lower legs. The more those muscles move, the easier it is for circulation to stay active. Try repeating this movement 20 to 30 times in a row. It should feel smooth and comfortable, not forced. If you perform the exercise slowly and steadily, you'll begin to feel the muscles in your calves and ankles working together. That's exactly what you want. These small movements help prevent blood from pooling in the lower legs. They also keep the joints in the ankles flexible and active. For people who sit for long periods during the day, this exercise can be especially helpful. You can do it while watching television, sitting at a desk, or even during a long car ride. Some doctors recommend doing ankle pumps every hour if you're sitting for extended periods. It takes less than a minute, but it can make a real difference for circulation. Another benefit of this movement is that it helps reduce the risk of muscle stiffness in the ankles and feet. When joints remain still for too long, they can become tight or uncomfortable. Regular ankle movement keeps those joints flexible and helps prevent that stiff feeling some people experience when standing up after sitting for a long time. Now here's something interesting that many circulation specialists point out. The muscles in your lower legs act like a natural circulation support system, but they only work when they move. If those muscles stay inactive for too long, circulation slows down. But the moment you start moving them again, blood flow begins to improve. This is why even small exercises like ankle pumps can have such a positive effect. They wake up the muscles that help keep blood moving. And when blood moves more efficiently, your legs often feel lighter, warmer, and more comfortable. Of course, ankle pumps alone won't solve every circulation problem. But combined with the first exercise we discussed, the seated heel raise, they form a powerful combination. Together, these two movements activate the major muscle groups responsible for pumping blood out of the lower legs. And the best part is that they require almost no equipment and very little time. Now, there's one more exercise I want to show you. This final movement is slightly more active, but it's still gentle enough for most people. And it works especially well for improving circulation in the entire lower body. In the next section, we'll look at the third exercise that helps stimulate blood flow through the legs while also strengthening the muscles that support healthy circulation. Now let's look at the third and final exercise that can help improve circulation in your legs. The first two exercises we talked about focused on activating the calf muscles and the ankle joints while sitting. Those movements are excellent for stimulating blood flow, especially for people who spend long periods sitting during the day. But this third exercise involves a slightly larger movement that activates the entire lower body. It's called the simple leg lift and march exercise. This movement helps stimulate circulation through the thighs, calves, and hips all at the same time. And just like the other exercises, it's gentle and easy to perform. You can do it while standing next to a chair or holding onto a countertop for balance. Here's how it works. Stand upright with your feet about shoulder width apart. Keep your posture relaxed and your shoulders loose. Now slowly lift one knee upward as if you're beginning to march in place. Lift it only to a comfortable height. There's no need to raise it very high. Hold that position for about 2 seconds, then slowly lower your foot back to the floor. Next, lift the other knee the same way. Repeat this gentle marching motion, alternating legs one at a time. Try doing this movement 20 to 30 times. As you lift each leg, the muscles in your thighs and calves contract and relax. Those muscle contractions help push blood upward through the veins in your legs. This movement activates a much larger portion of the lower body muscles compared to the first two exercises. And when more muscles are involved, circulation throughout the entire leg can improve. For many people, this simple marching exercise also helps reduce that heavy or tired feeling in the legs that sometimes appears after long periods of sitting. It also helps keep the hip joints flexible and the leg muscles active. If balance is a concern, you can hold onto the back of a chair or place one hand lightly against a wall for support. The goal is simply to keep the movement smooth and comfortable. Now here's something important to remember. These exercises are most effective when they're done regularly. You don't need to spend hours exercising to help your circulation. Just a few minutes of movement spread throughout the day can make a big difference. For example, you might do the heel raises in the morning while sitting with your coffee. You could perform the ankle pumps while watching television or reading. And the marching exercise can be done once or twice during the day to activate the larger muscles of the legs. Together, these movements help stimulate circulation in several different ways. But exercise is only one part of the picture. There are also a few daily habits that can support healthy circulation. One of the most important is avoiding long periods of sitting without movement. When you sit for hours at a time, blood naturally tends to pool in the lower legs. If possible, try to stand up and move around every hour or so. Even a short walk across the room can help restart the muscle pump that moves blood through your legs. Another helpful habit is keeping your legs slightly elevated when resting. Raising your legs above the level of your heart for a short time can help blood flow back toward the upper body more easily. This is especially helpful for people who experience swelling around the ankles. Comfortable footwear can also make a difference. Shoes that support the feet properly help the muscles in the lower legs function more naturally while walking. Tight clothing around the thighs or calves can sometimes restrict circulation, so choosing comfortable clothing is important as well. Now let's quickly review what we've talked about. Poor circulation in the legs often begins gradually. The early signs may include cold feet, heaviness in the legs, swelling around the ankles, or nighttime cramps. The 30-second circulation test we discussed earlier can give you a quick idea of how blood is moving through your legs. Then the 3 simple exercises, heel raises, ankle pumps, and the gentle marching movement help activate the muscles that naturally support healthy blood flow. Together, these movements help keep circulation active and reduce the chances of blood pooling in the lower limbs. The best part is that these exercises are simple, gentle, and require very little time. Sometimes small daily movements can make a bigger difference than people expect. If you try these exercises consistently, many people begin to notice their legs feeling lighter, warmer, and more comfortable throughout the day. And that's exactly what healthy circulation is supposed to feel like. If you found this helpful, consider sharing it with someone who might also benefit. Sometimes a few simple movements can make everyday life much easier.